Hi everybody, this is Dr. Leedia, creator of Koracare, and I'm really excited to be here with Dr. Ziv Simon today. Thank you for being with us.
Thank you for having me.
So part of my mission is to educate everybody about a few key points with regards to your oral health, and one of them is your gum health. And what better than to come to a specialist in gum health other than Dr. Ziv Simon himself. So periodontics, it's a long word. What can you kind of dissect it for us?
I can dissect it. Periodontics basically is the specialty of diagnosing and treating gum disease. So any form of gum disease, whether it's gingivitis, periodontitis, anything to do with the gums. The other aspect of my specialty is tooth replacement with dental implants. So that involves tooth extraction, bone grafting, soft tissue grafting, the implant process, all the fancy things we do in the office.
He's that and way more than that. He's created a surgical master which educates dentists all over the world on how to do everything he just listed. So when I was pregnant, Dr. Simon took care of my dental infection. So I was about 6 months pregnant, I think.
Around that.
And I give him a call and I'm like, I have pus coming out of my front tooth. And I have an implant here. I was born missing a tooth. And I can show you guys a picture. And I got an implant placed about 5 years ago and it started pussing during my pregnancy. And I was getting dental cleanings almost every month. Why do you think that happened to me?
It's tricky because when you're pregnant, you're dealing with so many other medically related things. But when it comes to the gums, there's the influence of the hormones. So you have a surge of hormones that goes up in the body that affects the gums in terms of inflammation, number one. The type of bacteria changes in your mouth, and in your case you had an extensive gag reflex, so you couldn't even put a floss in your mouth, or even your brushing was a little bit compromised, and it's a perfect storm to having an infection.
I had morning sickness for 8 months during my pregnancy. Why do pregnant women have more gum disease? You hear these things that, oh, I lost a tooth per pregnancy, or I got a dental infection, I got an abscess during my pregnancy, I got an infection and I lost my implant crown. I'm grateful nothing happened to my implant.
Exactly.
So why does this happen to pregnant women?
A lot of things are happening in pregnancy. So number one, there is a surge of hormones. Estrogen, progesterone are elevated. That changes the balance in the mouth, creates more inflammation. Number two, the changes in the bacteria, eating habits. Pregnant women are a little bit erratic about eating. That's one aspect of it.
I loved my bread.
That's
that was
okay.
the only thing that kept my nausea in check.
Nausea can make some pregnant women a little bit sensitive about flossing and brushing, and an increased gag reflex may not come for cleanings. There's a misbelief that when you're pregnant, you shouldn't see the dentist. So they don't see the dentist. They eat a lot of stuff, in an irregular way. Hormones go up, more bacteria.
Boom.
You get gum disease. Good news, it's reversible.
Just to get this out and clear, it's safe for a pregnant woman to come see their dentist or their periodontist for their dental cleanings during pregnancy.
Absolutely. It's important to come for regular cleanings and for checkups. However, the first trimester is the most critical. That's where all the organs, all the important systems are forming, and that's where you don't want to disturb anything. So the safest trimesters are the second and the third one.
Perfect.
And there's no harm. We don't use typically no local anesthetic. We don't use nitrous, which is laughing gas. Minimize any mouthwashes, chemicals, and things that can go into the system. So the least invasive, very conservative treatment actually is good for the baby.